Director of the Minnesota Ovarian Cancer Alliance, and I am joined by KrisAnn Talarico and Stacey Allen, and we are so excited to be here for this first of 4 sessions of our Navigating Wellness series in partnership with A Breath of Hope, which is where we're at right now. I know many of you are joining us online, and we are recording this so we can share with all of our members too. And this is in partnership to, we received a grant from the Minnesota Cancer Alliance. So for those who are newer to MOCA, I just want to share that we have a wide range of support groups and programs. So feel free to reach out to me, and I'm happy to connect you with any of the resources that you're looking for. So I'm really thrilled for this first session on the emotional impacts of cancer, because it's such an important topic that we need to continue talking about. And so I'm really excited that these two are going to be here with us tonight. And we lost our screen, but that's okay. We don't need our screen when we have these two with us. And I guess we do have a slide for the next event, but April 10th is the next meeting that we'll be having. So save the date for that. It's on integrative and complementary medicine. It's Friday, April 10th. So I think we can just jump into the panel so we can really get to it. So what we'll start off, I have some questions for our speakers, and then we will allow enough time. I'll keep an eye on the time, or maybe Kelly can help me. We want to allow people who have questions and comments and engagement. So when we really look at cancer survivorship, I know a lot of times we talk about the physical, recovery, but many survivors talk about the emotional impacts of the cancer diagnosis from when they're first diagnosed and all throughout their survivorship. So really this is about creating a safe space for those conversations. And I really want you all to feel like we can talk about this because it's real stuff that people are going through. So I just thank you all for being here. And I think we can maybe start if you two want to introduce yourselves and share what brings you here, and then we can jump into it.
Great, sounds good.
Why don't
you start? Hi, I am Stacey Allen, and I am the owner of InMind Health, and we are a group therapy practice. There are 8 of us now, and we only see patients that have cancer, chronic illness, struggling with grief and loss, and we also see healthcare providers around their own grief and loss in the workplace and their own mental health issues. So I'm really lucky to be able to be in the position of collecting other therapists around town that also have that specialty. And so I'm really excited to be able to offer that to the community. And we have some special programming going on, a meeting-centered support group that's coming up in April that is really different from the regular kind of support group. We're actually doing quite a bit of education around finding meaning based on Viktor Frankl's book, Man's Search for Meaning. So it really is a beautiful program. So I would encourage anybody to take a look at our website, which is inmindhealthmn.com. And take a look at our therapists. We have quite a few, and some that just joined the team that have open schedules right now. So it is really exciting. So I've been working in this field for about 13 years now. I started as a child life specialist and then a marriage and family therapist. And I've just been kind of honing this specialty for those 13 years. I also worked at Gilda's Club for about 8 years, facilitating support groups for them, for people that have cancer. So I'm just really excited to be here. I'm glad that you're all here and that this is also offered virtually. It's really lovely to have that opportunity for access for everybody. So thank you so much for having me.
Yeah, and I'm KrisAnn Talarico. I do want to kind of echo, thank you for having this be one of your first topics. It's such an important experience, but it's important for us to be able to kind of talk about it in a forum like this. I think it really validates how much of an impact cancer can have, not just on people's emotional landscape, but on their relationships, on their spirituality, on their sense of meaning and purpose, so many different impacts. I'm a clinical social worker by training. I went back to school when I was in my 20s to work with cancer patients particularly. And since that time, I graduated I think in 2005. Since that time, I've either worked in academic medical centers where I was the oncology social worker on the team, or I've worked in nonprofit settings where like MOCA or other organizations like that, where this the service and the support was for cancer patients and families. And then I've also done some work on clinical trials where I was the facilitator for example, there was a clinical trial called Helping Her Heal, where you work with the spouse of a person who has cancer, or a similar trial called Enhancing Connections, where you're working with the parent in terms of how to talk to your little child with cancer. So all of those experiences have been wonderful, and now I'm in private practice. My private practice is called Curveball Counseling, in part because, not to make light of cancer, but it is a huge curveball in people's life. And it's just a privilege and an honor, something I really take to heart, to be able to work with people at a time that's so wonderful. So eager to have this conversation.
Thank you. We are so grateful to both of you and just can't thank you enough for your time and expertise and your openness to talk about this. So let's first talk about the word cancer survivor, because it has many meanings for different people. Some like it, some don't. What are your thoughts on that? And can you share a bit about what you think cancer survivorship means, looks like?
Well, you know, just in terms of clinical trials and cancer research, an individual is considered a cancer survivor from the moment they're diagnosed. Now, that does not always sync with how people see themselves if they've been diagnosed with cancer. And I think in part it doesn't sync because sometimes we think of the word survivor as, this thing is in the past, I've survived this thing and it's done, it's behind me, it's in the rearview mirror completely, right? We have this sort of like all or nothing kind of experience with that word survivor. And so I think that can kind of get in the way of thinking of oneself as a cancer survivor. And, you know, my perspective is it's up to everybody's individual perspective about what they feel is the right term for themselves. But for me, I think that there is a lot to be said for the experience of continuing day after day to survive, not just the cancer, not just the treatment, but all of the ways life changes because of the cancer. So I think it has gravity. I think it has weight. I think it's really honorable to think about survivorship as like accomplishment. And again, not like one accomplishment, but many, many accomplishments along the way. So that's just my take on survivorship. Curious about yours.
Yeah, I guess it's been a mixed bag, I think, with the people that I've talked to and worked with as far as that word survivor. I remember when survivorship was starting to become kind of a bigger thing. They were starting to have, they being the medical community, the hospitals were starting to offer some classes or sessions with patients about survivorship. And I remember having a patient that I was seeing that I found out about this after the fact, but he was called into a survivorship meeting and he got nervous not knowing what that was and went into it thinking that this was where they were going to tell him that his treatment wasn't working. And this was about talking to the people that were going to survive him and how he was going to explain their survivorship to him. And so he was relieved to find out that he was the one that was being called the survivor. And he didn't feel like a survivor while he was in the middle of cancer treatment and felt a little disregarded because he had a serious cancer diagnosis and felt that it was a little discounting when he was facing something so big. Some people also don't like the idea that it is this survivor, warrior, battle. There's a big, fight that's being fought. And many cancer patients talk to me about the fact that they don't like that kind of terminology, that they're in it because they're in it and they're doing the best they can, and they don't feel like being called a warrior or a survivor. And so I just don't think it's necessarily the most effective blanket terminology that some people feel like they're just tempting fate even if they're being called a survivor. That, you know what, I don't really want to be called that because, I'm really afraid of recurrence. And I just don't feel like a survivor, and I don't want to be tempting any fate using that terminology. So I just think it's a very maybe subjective sort of a term that is not really identifying the uniqueness of everybody's experience. And I just don't know. I think some people would rather be called a thriver. They feel like they want to be, seen as somebody who's, doing more than just surviving, and they're actually thriving. Or I find that most people really don't want a term or a label like that. They just want to be called somebody that's living with cancer. And that's it. So I don't know, I guess it's just interesting, all the different perspectives. People really do have some strong feelings about that.
Yeah.
And other people feel very empowered. So it's not only that, but I think other people also feel really empowered by the term. They feel like it's hopeful. And so not everybody feels negative about that term. Some people do feel that it's hopeful.
I think it's like cancer survivorship too, it's so individualized, as we all know, treatment is, and it's such an individual thing. And so thank you for sharing those perspectives too. So fear of reoccurrence and scanxiety is something that comes up all the time with our survivors. Can you talk about that a bit and share some practical strategies to really help manage those fears in times of uncertainty? Yeah.
Now, what did I have about this one? Let's see. I think the fear of recurrence is it's something that's, it feels unique, I think, to each person. Yet it's there in pretty much every person I've seen, no matter what stage of cancer they're diagnosed with, no matter what type of cancer, no matter what they've been told about their prognosis, the percentages that they're given. People just don't really buy in all the time to the percentages. It's just hard to trust. So I think that the fear of recurrence is it's something we talk about in therapy all the time with most people. Maybe you probably find that that's true. They just don't trust their bodies like they used to. And it's really difficult to hear all the positive, don't worry about it kind of stuff. Don't worry about it. But I do think that it is something that people are just going to inherently worry about. And we really work hard on trying to find the holding of that unknown and living life today, knowing what you know about your cancer, whether you're in remission or not, but trying to just live in today. And getting through those scans is tough, because if you are in remission and you're going every 3 months, every 6 months, it's really tough. About 2 weeks before, people just feel a little more anxious. It starts to bubble up. It's in their gut. They feel it. They can't sleep. They're more irritable. And then it's like, isn't it your scan coming up? Well, yeah, but I'm trying not to think about it, but it's coming out in all these backwards and sideways sort of ways. And this isn't a test that you can study for. You just have to show up and you need to do it. And I think distraction is a great technique. Can't be your only technique, but I do think it's a really good technique. But you have to have some other ways that you're going to keep yourself in the present moment and taking care of yourself in that moment, so that you can just walk to that day and, take the information as it is. But we spend a lot of time talking about that, and how to do that well is not an easy thing to do.
Yeah, and I think going along with that, part of the fear of recurrence is it's happening up here, right? It's all of your thoughts, and they can be kind of swirling around. And they're not just here in the present moment, to Stacey's point. They are your thoughts in a projection of the future. And so if we think about that and we appreciate that that is very difficult to tolerate, not that that's a negative emotion, I try to stay away from like pathologizing emotions like that's a bad feeling. It's actually a really helpful feeling, because it does keep people, to a certain degree, it keeps people going back to their appointments, it keeps people following up on their scans, right? Like there's a reason we have those feelings. So it's important to appreciate the purpose of the feeling, but also to use these strategies to kind of dial down the intensity of it. So one way to dial down the intensity, when you can recognize it's in your mind primarily and it's in the future, to Stacey's point, is bringing it back to the present moment, but also bringing it back to your body. So things like, we put a few things in the back, like things like grounding yourself in the present moment by feeling your feet on the floor, feeling your knees as they're touching the back of the chair, feeling your bottom and your back as they're touching the chair. What does the chair feel like? What's the temperature of the room? What's the temperature of the table? Yeah, and I brought some of these, they're called calm strips, and some of them have little words on them too, but the point of the calm strip, it's basically a sticker that you stick on something that you have. And it kind of feels like sandpaper. It seems like a trivial thing, but the point of the sticker is to get you back into your body, right? You're getting your back, you're pulling yourself and your attention from your mind and your thoughts into your experience of your body. Oh, this feels rough. Oh, this feels soft. Just to be able to kind of reorient to the present moment, what's happening right now. So I don't know if you have other strategies for like being in your body, but I think that especially when you get to the point where you're in the waiting room or they've called you back and you're still waiting for the scan, right? Those moments can be hard and you don't always have as much to distract you. And I agree, distraction is a very, very important tool. But kind of thinking about like, what can I do in my body to ground myself? And another one is just basic box breathing. And we probably all have maybe heard of that before, but it's just this idea of like holding your breath for 4 counts. Inhaling for 4 counts, holding your breath for about 4 counts, exhaling for 4 counts, holding your breath. And it's just a way for you to be telling your body, we're calming down now. I'm going to engage the parasympathetic nervous system to help keep me calm, cool, and relaxed. And that kind of paced breathing can be very, very helpful. Just kind of keeping you back into this present moment.
Mm-hmm.
Very great. Yeah, I would say they're great mind-body grounding tools. And I think holding on to those and other ones are great to keep in your pocket. And even if it's writing it down, like, I need to remember to do this. Because it's a lot of times I feel like you hear, I should be doing this and this, but finding ways to actually remember to do them. So
there's
really
so
helpful.
many. There's so many strategies.
Yeah.
So it's
Okay.
in therapy, we'll spend quite a lot of time with patients teaching the strategies. There's quite a few. So some don't work for other people, and people just don't feel confident in others. So it's nice to have a whole
Toolbox. Yeah.
Mhm.
Yeah. Because you're right. What works for you might not work for me, and so it's kind of figuring those all out. So
Yeah.
Thank you.
Yes.
So many survivors describe holding conflicting emotions at once. So gratitude for survival, along with fear, maybe anger and sadness. Kind of that, whole realm of all the emotions. How can someone work through those emotional paradoxes?
Yeah.
You wanna start? I started last time, so maybe you can start this time and then I'll tag on you.
Well, a paradox is a paradox, I think, is that to be able to feel more gratitude or more of like the positive feelings of that spectrum, you have to appreciate the loss. And I kind of get hinging on what Stacey said earlier. I don't care what diagnosis you had. I don't care what stage you were diagnosed at. I don't care how great your prognosis is. Really isn't a way to not feel some sense of loss in this experience. And I don't say that to take away any hope as much as I say it to just give voice to it and to honor what you've lost, right? You can have what you've lost over here and still have what you found out about yourself through this process, what you've learned about yourself, what you've learned about other people. I mean, there can be both that exist. And maybe this is just like a therapist in me, but like, we will spend time talking about what do you feel like you've lost and what does it mean to you that you've lost these things, and can we recapture some of those or brainstorming around that. But oddly enough, I feel like that witnessing, that acknowledging, that honoring of whatever it is that you feel like you might have lost does tend to open people up to experience the broader range of the other feelings, including things like gratitude and hope and optimism that maybe they felt like they just couldn't access before.
I think it's amazing how humans are capable of two totally opposite emotions. It's so weird. And people always say it's so weird. How can I feel these two different things that are so opposite? But we're totally capable of it. I think of, like the passing of my mom, which just happened recently with dementia and from dementia. And it was so relieving to finally have this be over. And then so sad, mourning the loss of a mom. And how can I feel both of those totally opposite feelings at the same time? You just do. And you can, because we're capable of it. So I think that a lot of people feel, fear about the potential that they could die, while they're also experiencing hope, like trying to have hope. How can you do hope and fear of dying at the same time? So a lot of people feel like we're just going to do hope. Baby, that's all we're doing is hope. We're not going to talk about cancer. We're not going to talk about death. We're not going to talk about getting our finances together or teaching you how to change the furnace filter and turn off the spigot at the outside of the house. We are not going to do any of that because we're only hope. And it's not actually reality to only take one path, because I think it's good to step into some of that really difficult stuff, because it is a little bit of a opportunity to be able to do some planful thinking and conversations with the other people around you. That people that have tragedy happen that they didn't at all have a chance to plan for miss out on that opportunity, that this diagnosis gives people sometimes the chance to make some plans and have some really difficult conversations. So I think it's possible people say, well, I'm not going to talk about that stuff because then I'm giving up. And if I start talking about that with people that I love, I scare them and they don't want to go there. Sometimes they find that the other person is also thinking that same thing, that they don't want to scare you and they don't want to talk about it to scare you. So I think we spent some time talking about, what that might be like to have some of those harder conversations. What would it be like to make some of those plans and put some things away on the shelf when they're done? Then you can focus on the living with cancer with a little bit more geared in the hope, and maybe have a little bit more of a handle on the fear, knowing that just in case you've got some plans laid out. So I encourage people to live in both. I think that you need to spend a little time honoring the hope, and you need to spend a little time honoring some of those other deeper, darker emotions.
That's great. Thank you both so much for that. So this goes back to the question about fear of recurrence. Many people have expressed that ever since they were diagnosed with cancer, and I'm sure everyone here and online are going to nod their heads, and as I've been seeing in the audience, just yes, I understand. They're much more aware of their bodies after diagnosis, and it seems like every ache and twinge and pain is wondering if the cancer is back. So how can survivors live with that overwhelming fear that the cancer might return, and what steps can they do to trust their bodies again? So kind of a two-part question.
You want me to start this time? Yeah, please. I hate to be the bearer of bad news, but you can't, I don't think, really trust your body again. You've been I was going to say deceived, but that's not the word that I'm looking for. You've experienced something that you can't go back to this time when you didn't know cancer. And I think that's always going to be a part of existence from the moment on to the rest of the moments, that you're always going to be a little bit more hypervigilant about the feelings that you're getting in your body. A lot of people that I work with just like to have they kind of have like a 2-week idea in their mind. Like if this ache is still there 2 weeks later, I should probably go get it checked out. But that's usually after, going in after about 2 hours of having a pain, that you get nervous about in the beginning of this experience. It's just harder to have any kind of a trust that it isn't cancer coming back. So it's learning how to live with the sensations in your body and experiencing what those are like and knowing that they're normal, but with some caution. And so you have to learn how to live with that and what are you going to do with that? And then having those strategies for calming your system, recognizing that it's okay and normal to not trust your body. That's what this is. That's what's happening here. So it's just learning how to walk that path with these new ideas and these new fears. But it's a challenge. And it's not just like, take a breath and you'll be okay. Like the don't worry about it kind of thing that I was saying before. That just doesn't work because the worry is going to be there. We have to learn how to live with the fear and learn how to live with the worry and the unknown. It's a trick and it's difficult. Some days you're really great at it and some days you really stink at it. And that's really the nature of how this goes.
Yeah, and I think one thing I think is important for this group. I don't know how many of you knew about Clarity. It was an organization that was focused on ovarian cancer and caregivers. And they last year merged with Ovarian Cancer Research Alliance. But while I was working with Clarity, I had a chance to work with a lot of different ovarian cancer patients. And the trend that seems so apparent is that the time that it feels so like it really skyrockets is when treatment ends and you go into that kind of surveillance mode, or maybe you go into maintenance mode and you're on a maintenance, but you're not seeing your team as much. And there can be I've heard patients say, like, I don't feel like I'm doing anything, or I don't feel like I'm doing enough now because they're not in active chemo. So just to be aware, like, there will be times in this experience where we might expect it to go a little bit higher, that fear of recurrence, or not fear of recurrence, but also like, how do I learn to trust my body? And I'm feeling all of these aches and pains and they make me want to just call my doctor. I think for me, it's two things. It's, don't be afraid to rely on your medical team to help you sort this out, especially in that transition from like active treatment to like the surveillance period. They're there to help you figure out what's worth paying attention to, what is the new normal for your body, what is maybe a side effect that will eventually be going away on its own. So I think, don't be afraid to lean into your medical team. That's what they're there for. And maybe to try to take like not an all or nothing approach to trusting your body. What about your body can you trust? Can you trust your body to get you to the mailbox? Can you trust your body to, do a loop around the grocery store? Are there elements of your body and how it functions and what it does for you that you do trust? And recognizing that anytime you have betrayal, I don't know if that's the word you're looking for, but that's kind of what I think of it, is like your body betrayed you. Yep. Building trust happens slowly over time. So, you'll have some of these aches and pains. You'll sort it out with your doctor. Maybe you'll get a scan. Maybe you'll get more blood work. You'll figure out what that was. And slowly with each one of those experiences, you'll build more trust back up with your body.
So it is possible.
Yeah. Well, I don't know. Is it possible to get 100% back to where you were?
I would maybe not, but yes, I love that idea that there are places where the trust can exist.
Yeah.
Yes, absolutely. Yeah. Mm-hmm. Yes, very good. I love it.
That is good. It's a learning curve. I mean, this all is. So that's really, very helpful to hear. So thank you. So next question is that some survivors, many, experience long-term side effects like fatigue, neuropathy, menopause. How do the physical symptoms affect people's mental health, and what support strategies can help with that?
I think they're so hugely, well, I don't know if it's me. I'm just going to jump in. I think they're so hugely intertwined, right? When you're not feeling well physically, it's just so easy to be down in the dumps. And it just kind of sort of follows suit, I think. I think my words of caution would be, I come from an orientation called cognitive behavioral therapy, which is the idea that you have an event, you have thoughts about the event, and then you have feelings about more about the thoughts about the event than the event itself. So for example, two people could be diagnosed with cancer. One person could say, this is the worst thing ever. Another person can have these thoughts like, well, I'm just gonna take this one day at a time. We'll see how this goes. I don't know what this is, but I'll trust my team. And you can see how having one thought versus the other thought would lead you down very different emotional paths. So with that framework in mind, just this idea that how you think could contribute to how you feel, I would first try to caution. Wait, what's the question? All of a sudden, I'm like, wait a minute, where
So the physical symptoms, if you're having, the neuropathy or lymphedema, or how do those affect people's mental health, and what can they do? Are there strategies to help support that when you're dealing with the physical long-term side effects?
Yeah, so thank you. The caution is be careful what story you're telling yourself about the side effects you're experiencing. So sometimes the story can be, oh, I'm experiencing this. It's never going to go away. It's going to be like this forever. And having a thought like that is probably going to lead you to have feelings that are a lot more hopeless than a thought like, I don't know how long this will last. I'm going to do my best to address it. I'm a strong person. I've been through so much. I'm going to take this a day at a time. And so, we're all going to have those kinds of more doomsday thoughts. That's okay. No judgment to yourself, and I work on this all the time. So no judgment about these thoughts, but also a gentle coming back to, I'm not choosing that thought today. I'm going to choose a different thought. So that's not a strategy about how to help the physical symptom feel better, but it's a strategy for how do you not make the physical symptom exacerbate or make them worse.
Yeah, that's important. Yeah, that's really important stuff. It's really hard. I mean, I think people just get so frustrated with the side effects. You kind of feel like we fight the cancer, we do what we can, we get to this place where we're sort of coasting here for a little bit, but there's these nagging things that just don't go away, like the brain fog or the word finding issues or being able to stay organized. Those kinds of things, lymphedema, there's just so many different kinds of side effects. So there's, possible heart issues, and I don't know, there can be so many different things for, early menopause. There's just so many different things that people are dealing with. And it's just really hard I love the strategy of just choosing your path. How am I going to think about this? Because the way I'm thinking about it certainly isn't helping me. So when people get into that ruminating about all the problems and you just can't get out of that negative thinking, it's really important to recognize when you get stuck there and being able to say, all right, I've done that long enough. I've thought that thought long enough. I've been around this long enough. Right now, I am just going to put a stop to it, and enough is enough, and I'm going to focus on something else. So you get really intentional about what you're going to do. What are you going to focus on now? And so I always like to tell people, go to the place where your feet are, because where are you when you're ruminating about all the terrible things and maybe the future and the anxiety of the future and the depression of the past? You have to have a time machine to be in either one of those places. So you really need to just be in the place where your feet are, where you can take care of yourself right now. And what is it that your body really needs right now? What can I do to take care of myself? Do I need a nap? Do I need some protein? Do I need to get outside? Do I need to take the dog for a walk or scrub up the dog? Do I need to call my friend? Should I get in the tub? Do I need to read my, favorite book? Binge the stupid TV show that I don't want anybody to know that I watch? Whatever it is, but you just have to get yourself back to the place where your feet are. And another strategy that some research is out about right now is that when people are ruminating, it takes up a particular space in your brain. The ruminating does. And when you speak out loud, that needs that same space that the ruminating is in. So if you start talking out loud, it kicks the ruminating out, and then the out loud speaking is happening there instead. So I love to get people to do some positive coaching of themselves out loud So get out your coach that you're talking about. Like, get out your coach and be that positive coach that says, all right, we've had enough of this. This is not something that I get to control. So I'm going to focus on the stuff that I can control, and my side effects are, actually not one of those things. I can do my best to dial the symptoms down, but I'm going to focus on the thing that I can control. And you know what, Stacey, you're doing okay today. We are all right. We're dealing with these symptoms for a long time. I'm going to find the things that I can do, the things that I'm still able to do in spite of, and we're just going to keep focusing on that. And I'm going to go do something to take care of myself right now. So try the out loud thing and see if it helps get you back to a place where you feel like you're a little more present.
That's great. That's really helpful. That was new information. I know.
Voice.
Yeah, isn't that very interesting stuff?
Yeah. Wow.
It's true. And singing and humming, can do that same thing. If you get into the singing out loud, when you can you're in the shower and you're singing away, or you're in the car and you haven't had that you can't ruminate about the icky stuff when you're doing that. So it's really a great technique to try.
That's wonderful. Yeah. Thank you. I know we'll all be doing that, thinking about that as we get here. I was just looking at time. Well, let's do one more question, and then we can open it up to the audience and people online. So how can survivors deal with the shifts in identity, body image, self-confidence after treatment as they adjust to the quote-unquote new normal?
It's my turn, isn't it? Okay, so the new normal, it's just, you can't, people just not always. Many people assume that once they finish their treatment protocol, that everyone is just like, yay, you're done, and we can get back to normal now. And it's just they're all celebrating, and the person that is feeling this, like, okay, I finished my, round of treatment, or I finished chemo, they're not really sure what's next. They are hopeful that there isn't anything more that's going to be happening. And everyone is just on that bus. And it's really hard for the person that's been experiencing all of that to have that same kind of celebratory mood. And people think that you're going to go back now to your normal self, but I'm a bearer of bad news every time. There is no way that you can go back to that place where you didn't know cancer. You now have an intimate relationship with cancer, and you can't go back to the not knowing of that. And so it's an experience that life has delivered, and there's a lot of lesson to learn there. Nobody wants to learn it that way, but there's a lot of growth that happens for people in tragedy and suffering. And so I think embracing the things that you've learned, the new organization of your priorities, because that's probably happened, and focusing on the things that are just really value driven for you, and making sure that you're walking in that path, creating a bit of a different identity for yourself with a new focus. It's it's a new and different chapter that still has a lot of fear in it, but there can be a lot of hope there too.
Yeah, that's great. I think I would also say a personal invitation to do an inventory. Looking back from the moment that you were diagnosed, or even the moment that you kind of knew something was wrong, felt something was off, until where we are today. And I would do this writing it down on paper. What is everything you've learned? What are the skills you've learned? What's the information? I mean, did you get a medical degree along the way here, right? You learned a new language, you figured out where the hospital is and how to get to the cancer center and how to get to, there's so much that you have learned. And not just that, cancer upended your life at a time probably you didn't predict it, you didn't ask for it, you didn't invite it, you didn't want it. You adapted, you reorganized your priorities, you shifted responsibilities, you maybe took on roles you didn't want, or you had to give up roles you really wanted. So I think it's important to mark the milestone of like, yeah, this was not on my bucket list, but like, look at everything that I did learn through the experience as a way to begin to restore some of the confidence that you might feel like you've lost. Now, it's different with body image. I think some of these things are they're put in one bucket in one question, but it's it's unique. But kind of to that same degree, right? Like if we take body image, thinking of trying not to have all or nothing thinking about your body. So like my body's good or my body's bad, or my body looks good or it looks bad, but really trying to like get into a more detailed kind of specific level to see where you can kind of rebuild some of that trust.
Yeah. It's wonderful. I know that we should have this for hours because all of the things you're saying is it's so powerful and so important, and there's so many things we need to keep reminding ourselves. So I just love everything you guys have shared. We have about 15 minutes left, and I do want to allow people, if they have questions. I got a message that the chat box was disabled. It's able. Okay.
It is able.
So if there are questions, I don't know if they've come in on the chat box, and then you guys too, one. So we can start online, and then if you guys have questions here too.
The first thing that I see is they'd like you to discuss survivor's guilt. Was the question.
Survivor's guilt.
Survivor's guilt.
Yeah, that's on my list. So we had a pretty long panel list. Just we didn't know how long we'd get through, but that is something that comes up quite a lot. So how do people manage survivor guilt as they're going through this?
It's a really tough one. It's common. People talk about it a lot. Feeling like, why am I? Well, you're talking about cancer patients themselves feeling like they are maybe shouldn't have lived through what they lived through, knowing other people that hadn't. I think it's a really difficult spot for people to be, but it's like the value of somebody else's life maybe being more important than somebody else's. There's just that these are things that people could ask these questions all day long, like why me, and why not me? Because I think we just don't get to know these things. It's about, you can ask that question all day long. Why did I survive and somebody else didn't? There are so many things that we as human beings just don't get to know. And we have to learn to live with the ambiguity of life. And it is maybe the way that you can then encourage somebody to possibly live in honor of, the people that didn't. And it's taking a lot of responsibility then for you to try to step in, as best you can, that you are alive and you've got an opportunity to live whoever knows how many days, but, do what you feel like you might want to do with that. And spending too much time trying to, do all of the existential thinking and figuring out the why, those are not questions that we get to know the answers to. So I encourage people to use their energy on things that they can control versus the things that they can't. Took me a minute to get to it, but I know
because it is such a challenging.
Yeah, it is.
It's a challenging experience. It's a challenging topic. I think I love the honoring piece. I think that is can be a very helpful tool that this person that I knew didn't survive this, but here's what was so important about who they were as a person to me. And here's how I'm going to carry that forward as a way to, talking about as a way to have there be something practical you can take from that feeling that you're going to do differently, even if it's, honoring your own experience more. Some might think of what we're talking about is how to tolerate the challenging emotions that come with it.
Yeah, that's right. Many people will say that they get the cancer diagnosis and the physical stuff that they can do the physical stuff. It's hard, but they can do it. It's the emotional stuff that really, they don't know what to do with that. And there's not a lot of people, the physicians aren't saying, how are you feeling about this? Like, how's your family? They might be, but they don't really have a lot of time for that kind of stuff. So it's nice to be able to sit with people that are sitting with people a lot and having these conversations. It's really a difficult spot to be. The emotional stuff really surprises people, how big that actually is. Any more?
That's what we've got right now.
Wow. Do you guys have any questions in our audience here? If not, I can go to my list too, if you guys want. The next we have on here is how is the best way for survivors to communicate their needs to family members or loved ones who might not understand what they're going through?
Yeah, well, I think the natural caregiving tendency is to caregive in the way that you would want to be cared for if you were the person that was ill. And sometimes that works beautifully, and there's a lot of being in sync with the other person. And sometimes it can feel like a real miss when somebody wants to be cared for in a particular way, but their loved one is offering this other thing. Right? That sort of the classic is like, I want to talk about my feelings and my partner wants to fix them. Like, that's just so classic. So what you could do, and this goes for whether you're the patient or the caregiver, is to really get in touch with what you are needing and what kind of support would you be open to? What kind of support do you think would be helpful? And to really try to front load that as much as you can. Now, probably you'll learn what doesn't work by having somebody offer something you don't want. We just will learn that way. And so maybe if there's a way to give grace to each other in situations like this, right? It's a learning curve for everybody. As much as you can be clear about, and I think the clarity first comes from being in touch with what it is you need first and trying to be clear with other people.
It's so complicated. I think so many people are like, oh my gosh, you look so good. Cancer doesn't look that hard. I mean, you must just be totally that you look so great. And then people don't really have any idea what you've done to get yourself there looking like that. And that you had to rest for 2 days before and that you're going to be in bed for 3 days after recovering. They don't really have any idea. So, I think it's that you can educate everybody. I mean, it's just really a hard thing to do. You don't want to be the one that has to be the educator all the time of everyone. So that gets to be really hard. But people really don't understand, and lucky them that they don't understand. But I do think it's hard to find the support then that you need. You kind of have to pick your people, and you have your core folks that really get it. You can, let it all out with them. But you have to decide who you're going to educate, how much information you're going to give. It depends on your mood, your relationship with that person, what is happening in the situation that you're in. But many people will not understand. And, we've talked about with patients, wouldn't it be great if you had like a little card that you could just give out? It would explain the diagnosis, the common symptoms. These are the things that I would really like. I need cards in the mail with funny pictures on them. Or, I just want a card from you in the mail every week. Or if you could swing by, send me a joke every day on text or something. That's the kind of stuff that I would really like. I had one patient just tell me recently that people were, she had some friend of hers that just kept sending like protein shakes and, like all this stuff, like recipes and things that, this is the stuff that you need to do and you really should do this. And I read an article about this and I think you should try this. And, she said, all I really wanted from that friend was for her to just say, what do you need? What helps you feel good? How can I support you? What is it that what do you do around your house every day where you find some peace? How can I make that maybe happen a little bit more? Just want to have a conversation, just have not the fix it, kind of folks. So some folks show up with all the fixing. But they're trying. they're trying to connect, they're trying to be helpful, and they're not really sure how to talk about it. So they're trying to just get to the tasks and the doing instead of the really deeper relational stuff, because they just don't want to say the wrong thing. They can't relate because they really don't understand. So it's complicated. The relational stuff is very complicated.
We need another session on that too, right?
Yeah.
Really, yeah, there's so many different pieces. Do we have any more questions? Otherwise I'll end with, no? Okay. We'll end with this question. We just have a few minutes left. If you have one piece of advice or one silver lining or one tidbit, anything that you want to share with anyone going through ovarian cancer or their loved one, any piece of advice about mental health or just about the emotional piece of it, any tidbit if you want to leave us with. Who's going first here?
Yeah, I think you just have to own your own experience. And it's going to be a, roller coaster for sure. But I think you just have to have an open mind about the things that are coming at you. You have to take things one at a time and just go slow. I think a lot of people feel like they're going to, do the thing that the doctors say, and then everything is going to be okay after that. And, my experience in working with so many people is that it's a little bit more curvy of a road than that. And it's not always so much just like this and then that and then done. Or even if you get, a diagnosis that's maybe a stage 4 and maybe how this is going to end, you don't really know the path exactly, and just to be a little bit more in the moment without a lot of expectations, because expectation can really lead to more suffering. And so you just want to be able to let each thing sort of unfold as it unfolds without needing something to be a certain way. Be a little bit more curious and helping yourself in the moment.
Yeah. Yeah, I think mine is a story about a woman that I worked with who she had breast cancer previous to her ovarian cancer diagnosis. And she said to me, if you would have told me when I was diagnosed with ovarian cancer that I'd be at my 4th line of treatment, I would have said no way. Because I had that experience with breast cancer, and I had my diagnosis with ovarian cancer, and I had told myself, I'm going to do frontline treatment, and then I'm just going to, if I have a recurrence after that, then I'm just going to stop. And so she said, I never would have thought that I would have chosen a 2nd line and a 3rd line and a 4th line, and she's finding joy in life. She's connecting with friends. She's having to pace herself. It's not all amazing, but she was talking about how she was able to find still a high enough quality of life that those decisions felt right for her. So I just offer that in the sense of no one knows, even if you try to predict it for yourself, what you might decide or what might happen in a particular moment. And you might find more resilience within yourself than even you would have expected. I think that's been the real joy of doing this work. I'm sure you've seen that too. It's just people really find so much a part of themselves, so much growth and strength that maybe they didn't.
That was a beautiful way to end us. Yeah. And again, we could have this conversation for hours and hours. And so I just want to thank you both so much for your time and your expertise and your compassion. And we're so grateful that you guys were able to be here with us today.